On today's episode of Real Americans, I get to speak to American nurse Ostin Broadhead. Ostin touches on all aspects of the healthcare industry. He goes in depth about the ins and outs of being a nurse, especially in this time in America during such a health crisis. Now, in Real Americans, we don't like to endorse too many things, but today we ask that you go and visit showinc.org. Showinc.org, showinc.org, is a nonprofit organization that operates programs to meet the needs of persons with developmental disabilities in the Sapulpa or Tulsa, Oklahoma area. They're providing job training, services through recycling, janitorial contracts, and landscaping contracts for these adults. They also provide daycare and summer camp for children with disabilities. And they also provide assisted living to help adults maintain their independence, and they have an adult day services for people no longer working full-time. We ask that you make a donation to Show Inc. or reach out to them and see if there's any way possible you can help out. Or you can email them at recycle@showinc.org or give them a call at 918-224-7214. Again, that's Show Inc. They're doing great things over there, trying to help out those in need and while also providing a service to the community. Today's guest is American nurse Ostin Broadhead. Ostin is a great guy, family man, hard worker, entrepreneur, and as you'll see, a very compassionate human being, and also one of my dearest friends. So without further ado, episode 3 of Real Americans. Hi everyone, welcome back to Real Americans. I have a very special guest today. He is a nurse in the healthcare field, and he's going to talk to us today, not just about his job, but about the experiences he's going through right now in the industry with everything going on in America. So without further ado, I want to introduce you to Ostin Broadhead. Ostin, welcome to Real Americans today, man.
Hey, man. Thanks for having me, Gatlin. It's nice getting to talk with you again.
Hey, it's always nice, brother. Anytime I get a chance to talk to you, it is literally one of the best parts of my day. And I'm excited to get to, shed some light on you and your job and enlighten the people on what's going on in the healthcare field right now in America. So
yeah, definitely.
So without further ado, I just why don't you just tell everyone what you do and kind of the ins and outs of your job?
Well, as you said, I'm a nurse and I've been doing it for about 8 years. Mostly ICU care. I've done some surgery care within there. I currently work at a few different facilities, actually, in the area. So I get to kind of see aspects of different business models, but in the same field, which has kind of been interesting over the last few years doing that. But primarily working in the ICU, I get to take care of really sick people, people on breathing machines, all the medications, keep your heart going, slow your heart down, speed it up, squeeze it. Taking care of people primarily with neurotraumas, so strokes, things like that, and then trauma patients, burn patients. So got a pretty wide gamut of patients I take care of, but they're all very sick. So that's what I do routinely. As I said, I do a little bit of surgery. Done that for a couple years now, so get to see the healthy side of people too, coming in for elective procedures and getting those done, which is the total other end of the spectrum. People electing to come in and get something worked on when they're nice and healthy and get to have a good surgery and come out with good outcomes.
Exactly, and I think that's really cool that, like you touched on, you're in the ICU, especially the neuro side of things. How does a guy like you get to that point in nursing? So if you could tell people, like, what's the steps in being a nurse, and how do you get to your level of where you're at right now?
Yeah, so it's kind of different. A lot of people think that when you start out in the nursing field that you have to go through different levels of patient care to get to that critical care setting, the ICUs. But it's kind of about where you start out, so your skill set as you come out of your school, your programs, and then what you want to do. So for me, I came out, did some emergent care for the first couple of years, and realized, that I wanted to kind of dive deeper into people's illnesses, not just treat them right then and then send them either, to a floor in the hospital or back home, send them back to the street. So kind of made me want to go that route. So I went to the burn side of things and spent a few years only in the regional burn unit here. So that's kind of how I got started in it. But then from there, just kind of as my career's developed, just taking those steps to go to the next challenge and try to push myself, to learn more and be more knowledgeable for the patients, the families, and to be able to actually help progress the patients, during their illnesses.
And so, for the people that don't really know, what inspired you to get into the nursing field? What made you say, that's what I want to do, and I know that I want to be able to help people who need their health. What told Ostin Broadhead, said, hey man, you're needed in the nursing field?
Man, it's kind of a wild thing. It's it's not really far off of what a lot of people get into starting out life, but this is a kind of an area that stuck with me. One day, and I was still in high school, and my mom had told me like, hey, you need to kind of figure out what you're wanting to do. You need to kind of have an idea. As you're taking these college classes, you need to know what you're going to do. And I said, I'll kind of figure that out, but I think I'm just going to play sports forever. But that quickly turned into her telling me to look into some healthcare options, as far as, having a job. The stability in it is definitely there. It's tried and true. People are going to get sick and they need help. And she told me I was compassionate. At that time, it's kind of your high school, punk kid, and you think, oh yeah, I don't know how nice I am. But so my mom led me down that path, and she didn't push or tell me I had to be a nurse. She just said healthcare. And so I looked up the avenues of nursing, and there was so many options out there that I could do so many different things. And if I decided to switch it up a little bit as I'm progressing through my career, there was options to do that. It wasn't just a stagnant career. And so taking care of people has been the main motto this whole time, and just being able to have that flexibility to do that in different avenues is kind of how I got into it, and it's what keeps me in it.
That's awesome, man. I feel like a lot of people are still looking for that kind of side of their job, wondering their why of why they're doing it. And the fact that the why behind why you do what you do is, I think, awesome. And just to me, then I already know how far you're going to go and how successful you're going to be in that field, just because of your why in it. And I know how compassionate you are. You're one heck of a compassionate guy. And I think if I was in a room and you walked in, I'd probably first go, oh man, I got to be a male nurse. But I'd probably go, after a while, I go, okay, I'm glad I got him. His hands are pretty soft, and he's, got a cute smile. But, honestly, yeah. What's it like? What's it like being, because there probably is a stigma in it for you being a male in that industry. What is it like being a male nurse in, I would say a female-driven industry?
Yeah, man, it's been crazy. And you wouldn't think that, with me saying I've been in healthcare for about 8 years, that there would be much attached to it within my time frame. It's been pretty progressive as far as, industries changing over and having, male and females work side by side in all different aspects, no matter if it's construction work, if it's cleaning places, detailing of cars, or healthcare. So the idea of male and female working together in the same industries now, where one of them was dominant before, doesn't seem like it would have changed that much, but it has. I answer questions almost daily, I'll just say weekly, to your older patient populations, which we have a bunch of, and family members that you have to say, like you come in and you say, oh, you're the nurse, I thought it was a woman or a girl that was going to be in here. And you say, well, no, this is what I do, and they say, well, are you studying to be a doctor? And I'm like, no, I don't have any dreams of being a doctor. I'm just a nurse, and I'm here to take care of you. So there's definitely that gets brought up all the time. So that older population is still kind of growing and learning and becoming, more comfortable with it. But over my years, I've experienced that I've had great outcomes, that even those people and patients, the family members too, that, were kind of hesitant at first, think like, oh, this guy's going to be in here, by the end of the shift. They're like, man, I'm really glad that you're here with me today. It really, you're really calming and comforting, and, it's a lot different than I thought, so thank you. Mm-hmm. So I've actually got to feel like change a lot of people's perspectives and mindsets, when it comes to that. But it is something that definitely comes up all the time.
That's great. That's cool, though. That's another little aspect of your job I wanted to touch on that, a lot of people don't think about a lot. For guys, especially like you. I mean, and it's funny, you're not trying to study to be some McDreamy doctor like off Grey's Anatomy or anything, but you definitely understand Ben Stiller's pain and Meet the Parents, right?
yeah, it's definitely that stuff's real, and even down to dealing with family members, and going through school and stuff, telling them you're studying to be a nurse, and you're trying to be tough about it, and you don't really know why, but you just have to still stick up for yourself and tell them, no, hey, I'm another part of this healthcare team, I'm just out here helping people. So that's just something that's going to be a part of me.
If anyone I could say as a man that I know, as macho as could be, you are the epitome of a macho man. So like the fact that like you're a nurse too, to me, it's beautiful. It's kind of what like it shapes and kind of tells your story. I mean, you're Austin with an O, which is very unusual too. We don't get that a lot when you meet many Austins in your life too. So I think if you meet an Austin with an O. Yeah, exactly, right?
Every patient we start with, every time I go into a room, they're like, who are you? And then, I'm Austin with an O, and they're like, what? And so that sometimes can throw them off their next question of asking, like, oh, I thought you were the doctor, So sometimes I can break it up with that. So yeah.
Well, that's great. And that's what I was, like I said, I was wanting to touch on just to kind of get and see what it's like for you on that side of things. So now if you could, would you kind of let everyone know, like, what's the day of a nurse look like, whether you're the night shift nurse, whether you're, the day, what if you could just kind of give us like, what's it like on like a regular day for a nurse? Like, what's your check-in, what's it out and stuff like?
Yeah. So, I'll just go over kind of the universal things, each unit, each facility, hospitals and things like that can have just a slight variation. But a lot of times, your start time, we'll just go through the day shift part of it first, and we can touch on the night shift part. But your day shift part, you come in and you usually get there between 6:30, 6:40, and get clocked in. Some units have the huddles, where you actually meet as a team, all the nurses in there with your supervisors or charge nurses, and get your patient assignments and kind of get the rundown of what's going on in the unit, if there's any updates. And then from there, you go out there, and take report. You do bedside shift report, which just means that you go in, you introduce yourself to your patients, you talk about, what's going on with the patients, their history of their illnesses, kind of get a rundown, of everything from head to toe, what's going on with the patient and, what you're treating primarily and what brought them into the hospital that time. So once you get all that information down, then you kind of get into your task. It's pretty widely known, through healthcare workers that, nurses are task-driven people. So we like to kind of know what our tasks are and complete them in a timely manner. And, a lot of people like to complete them early, even just to, stay ahead and just in case something changes or, something different happens during the day you weren't expecting. So you get those tasks down. Some people write them down. Other people just kind of work off of their computers. A lot of the computer-based systems now kind of keep a work list for you. Kind of tell you what you're supposed to be doing, like kind of break it down even by hour to let you know, is there lab work? Is there, positioning of patients? Is there, wound care? Is there, things like that you need to do, consents? So as you work through your shift, that's primarily what you're doing. And then you have procedural stuff. So whether it's taking patients to CAT scan, taking them for MRIs, taking them down to surgery, any of those other procedural things that could be happening with, your patient during that shift, that's the other things that come up throughout the day, as you're working on people and, getting new orders and implementing orders from the doctors. You just work on that stuff. And then it turns right back into a shift report. You usually do shift report about 7 to 7:30. So it turns your, what everyone thinks is a 12-hour day into an easily 13-hour day. If nothing crazy happened, if something crazy's happened, then you'll, be there for an extra 30 minutes, charting stuff up or getting things done. So it's a pretty long day. So just to kind of progress into the night shift side of it too, you asked about that. I've done that a little bit throughout my career, and the difference for them, is trying to maintain throughout the night. There's not as many physicians available, so there's a limited amount of doctors to go around when it comes to night shifts. So those nurses are a little bit more on an island. Have to not think more independently, but they do have to kind of use some different skill sets throughout the night shift that the day shift crew doesn't have to think about as much. The day shift crew has a primary care physician, that's available for the patient, whereas the night shift has one nocturnist that, might be keeping track of twice as many patients as the daytime doctor. So, they have to battle that and kind of balance it. And then they do a lot more lab work throughout the night, just routine lab work, that you have ready for the day to start early in the morning for the doctors coming back on shift. So they have some of those things to focus on throughout the night to get completed. And that way, like our days, kind of turn back into doing some more of the procedural things that maybe some of that night shift lab work or workups presented, and allow them to do their part to help the patient, get in that position to have those things done.
And there's so much to it that even, just you telling us that right there barely probably scratches the surface of the true in and out of what your job really entails. But there's so much to all that, all those little things that you were talking about, that I think that, that goes unnoticed all the time in hospitals. We just think you're coming in with a chart and then saying, hey, what's next? Or like taking our IVs, taking our blood pressure, our temperatures. There's so much more to being a nurse that goes unseen, just as there is in a lot of other jobs. But I think that's what's really cool, is that you're putting in long hours too, and that's why they have kind of like a universal understanding of like the hours and the days and nurses work. But what in your idea, or what from your understanding, what is kind of like a normal schedule for a nurse, someone who's being a nurse full time as their profession?
Yeah, so a full-time practicing nurse, especially in the hospital setting, is primarily 12-hour shifts. And with those 12-hour shifts, they usually are set for 36 hours a week for full-time nurses. Now, if you go down to those 8-hour shifts, maybe working surgery or cath labs or other procedural areas, then those shifts can vary, 8 hours, 10 hours. And then usually if you're 8 or 10 hour shift workers, then you'll pick up a 40 as your straight full-time employee. So, primarily me, I do the 12-hour shifts in ICU. And so 36 hours a week is my minimum. As I said before, I do some other facilities, working some resource positions. And so by doing that, I work an extra, shift or two a week. And so, that 36 hours gets turned into 48, and so on. So a regular full-time nurse would just be 36 hours. And then, of course, like I said, each one of those shifts was really 13 hours or more long. So it's you kind of get 39 hours just if you worked your 3 days, and that's with no hiccups or anything, trying to get out of there on time and actually let you, go back home to the family and, have that time that people think that we have. So.
Yeah, exactly right. It is not near as much time as everyone thinks that comes along with being a nurse, but that's, like any job, there's lots of stigmas with that too. I think it's kind of what makes me want to transition into, you touched on you're in ICU and your elective surgeries and things like that. How has that changed since the whole crisis has happened here over the past, almost 2 months now? What is the healthcare industry like? What's the changes like from the normal side of things you've seen? And how has it affected you in your hours?
So thankfully, in the region that we work in, and then the area that I work in, hours, I've been pretty fortunate, to still keep my hours. There's been facilities that have furloughed, nurses and ancillary staff and people that are part of the care team. They may not be directly involved with the patient, but I've definitely been able to keep my hours. It's been a little different because where I might work some extra hours and extra shifts in a surgery area, they aren't in need of that extra help right now. They've had to stop doing elective surgeries, so their department's kind of running on their skeleton crew, which just doesn't allow for extra hours there. So yeah, definitely with the pandemic going on, that's been a change. As far as just having to, find the areas where the facility needs help, and try to work towards that as far as, picking up a little bit extra to help out. And so the ICU areas have been, the most in need, with the increased use of, ventilator support, the breathing machines for the patients, with the actual illness, along with your patients that were already using them in their normal illnesses that come out throughout the year, your exacerbations of regular diseases, and then also, people that get sick just during this time period that has nothing to do with the pandemic, using those machines. So definitely increased the need for some more ICU care.
Well, now, I've noticed, I just saw recently a report that right now the hospital industry, healthcare industry, this whole last month and a half, them preparing for this one thing and not doing elective surgeries as much and not doing all this has really hurt their bank. And I've saw where a lot of hospitals are on the verge of bankruptcy. So being in the industry and being through all this right now, do you notice that kind of stuff too? Like, supplies being a little bit lower, certain things, like just because you can see that the money's not there because the money that the hospitals are used to having flow in this nice cycle aren't happening right now.
Yeah, that's definite, man. That's a good point to talk about because you'd think more people being sick, there's more money coming in, but that's really not the case. These people being sick is a special situation. And so the cases of those sick people even, actually continue to be hospitalized in certain regions isn't the same, as you see in some of the areas up northeast and then, out even on the West Coast and stuff like that where, those are densely populated areas. And yeah, maybe some more of those illnesses have increased their hospital census, their amount of patients they keep at one time. But ours, without those elective surgeries and all those procedural areas that were working before, a lot of our units don't have the same flow of patients, that get admitted one day and then a couple of days later are discharged home. So they don't have just that basic turnover of rooms. So right now, a lot of the units that aren't the critical care areas, are lower in patient amounts. So their census has stayed down. Which does cause the hospitals to kind of look to areas to take some cost away, as far as buying extra supplies where, your surgery area doesn't require as much supplies if they're not running at full capacity. But at the same time, those surgeries, they do bring in a good amount of money for the hospital. Those surgeries are usually pre-approved by insurances. So those insurances are already planning to pay. The hospital is already planning to get that money. So when those surgery schedule boards are full, the hospital's in good standing usually on the books. But definitely right now, we notice in our supply areas, there's simple things that sometimes aren't there. And it's really not to any fault of, the facility or anything like that. They're trying to do what they can to keep us employed. So they're, we're in the business of helping people, but to help people, we have to have a good business. And so business involves money. And the sad truth of it is that, healthcare is a big money business. And so we definitely noticed that there's some supplies that, are running a little low. We kind of ration them a little bit, not to the point of harming patients or not using the certain things we're supposed to use, but, maybe whereas you might have extra people on hand to do a procedure in a room. You just have what you need in there, and don't use those extra sets of, sterile gloves or mask or, kits of certain kinds to, do that same procedure, and just be mindful, is the basic part of it, and to kind of help with some of those costs. So yeah, definitely noticing that, and noticing the hospitals. They try to keep us informed. At the facilities I'm at, they don't try to hide that from us and tell us, oh no, yeah, we're making a bunch of money. They try to let us know, hey, this is why this is this way right now, and just hang in there, and we'll all just kind of work through it together, and then at the end of it, we'll get kind of back to our normal status quo.
Yeah, that's a really good point too. A lot of people don't understand is with all this going on that the flow isn't there for money, and with you talking about the pandemic, I kind of wanted to also, I don't know how much you can delve into this, but have you had to come across any patients recently or in this time frame that were COVID-19 patients, or how has this experience been for you from that end of things?
Yeah, as far as the patient population we have, I've taken care of personally, several patients that's been COVID-19 positive. Yeah, that's definitely a population that we still deal with. Like I said, in our region, it hasn't been as bad yet as they've projected. Some of those timelines keep getting moved. It's kind of a fluid situation. So every area kind of, region of the country and world right now are kind of standing on their own numbers, so, projections really haven't been, the thing to go by. It's just kind of, what comes up you deal with and you take care of. And right now, yeah, we're taking care of them. We've got, units set aside that are supposed to primarily be those units in our facilities. But, still, if one of the patients is already in one of your rooms and you've got, negative pressure to have those patients in there safely per the guidelines, that's been put out, by the CDC, then, those patients will stay there. And so, yeah, we've taken care of them. Myself and all the other people on our units had their share of taking care of these COVID-19 patients.
Have you noticed here lately though, like less cases coming through, or do you think we all hopefully this is going to end sooner rather than later, but have you kind of noticed where you're at the curve or whatever, like we've kind of flattened the curve at the point like in your area?
Well, so yeah, if this curve, this chart, this growth of cases is, to be put out there, then I think, yeah, right now, our curve has flattened out, maybe gone downward even. But I don't know really if it's kind of just a calm before the storm, so to speak, or if it's one of those times that, we're really kind of getting closer to the end of this season for this virus, and maybe with some of this warmer weather coming, be kind of the stop and the halt to the severe amount of cases. So I do think that, in our area, in our region, our cases have gone down, not to the point of, getting rid of those units that are set aside, but definitely to the point where we've been able to kind of switch a couple units back over to their normal units and do normal operations without having to worry about being overrun with this COVID-19 patient.
Do you think, now, I don't know, I may get you in trouble for asking this, so we can always edit this out later, but how nervous or how serious, from like your experience with this virus, what is your overall, a lot of us don't know a lot about it, and you probably know more than just the common person, but what is your level of urgency, emergency level of scaredness, I guess would be the right way to say this, with this virus?
So I'd kind of say that with this virus, it's with a lot of people, including myself, it's been more not that it's an emergent situation, as more of as a situation that creates pretty good anxiety, even for just the normal healthcare worker, and the people that are deemed essential workers, for that aspect, all the people, not just us in the healthcare field, but the people, still working to do their part and keeping everything going. it creates a lot of anxiety, and not the kind that, requires you get all hopped up on some medications to, be able to perform your job. But, the kind that, as people keep talking about it, you're thinking like, okay, I've taken care of patients in these types of environments before, whether it's a TB patient or, other patients with, airborne type illnesses. We've taken care of those patients. We've, been trained to do that stuff. So it's not one of those situations where we didn't know what to do, but more with this illness and this virus is that we didn't know exactly, the transmission of it. So even as things were coming out and studies were being done in other countries and the United States has taken a look at it, we didn't know. So some of that changing each day you come into shift thinking like, oh man, well, we didn't do that yesterday. Have we been exposed in a way that we weren't prepared for? Which has created some anxiety and some, uneasiness for, us as the healthcare workers and that group of people is just, it makes it hard, as things are changing, to know that you're doing the right thing, for yourself to stay healthy, but also, for your patients to not transmit it or make things worse. Definitely has been a difference in this type of illness.
Well, this is probably going to be more of an opinionated question and answer, but I would like to know, like, from your experience with all this now, and one of our past guests mentioned it last time, like, he thinks this is a big reality check for America and a big reality check for individual Americans in a financial standpoint, in a health standpoint, in lots of ways, big reality check. How do you think this is going to be a big reality check for the healthcare industry?
I think it'll change the kind of the structure, the overall structure of how we keep supplies. So, we talked a while ago about business and, being part of the healthcare industry, being a business, is that you have to plan for things, but you also can't just go out and, buy the world's stock in ventilators when you only need 40 of them on any given day. You don't want to have 300 sitting in a warehouse. So I think that really, to keep things in reality perspectives, you don't have pandemics every day or every year. So to kind of fault anybody would probably be, a tough thing to do. You couldn't really say, that it was just America's fault for, this or that. But I do think that it'll cause people to look into things a little more closely next time, that maybe a situation like this happens, that, maybe the first word of it, the first spread of it, will kind of catch our attention a little bit earlier and allow us to make preparations for the influx of patients that we could see in the next coming months versus, kind of being on the tail end of it and then being kind of caught on our heels, with our pants down. So I think that it will change in that perspective. But I don't think, that, reality check, maybe so. But like I said, pandemics are hopefully will continue to be, few and far between. So I'd like to think that, we won't have to see this again in our lifetime. And so maybe our same generation that's talking about it and experiencing it now won't ever even see the remnants of, maybe another situation, but, maybe can help set a precedent of things to do and not to do in the future, and just kind of build on that. I don't think there's really any other way to go about it. Just say kind of like learn from what we've done and, maybe buy a few more masks before the price go up, the next time. So that would probably be the best thing to do.
A little more hand sanitizer.
Yeah, hand sanitizers and maybe some more cleaning wipes or something. So,
I think that's a great point about like everything you're saying. Just being more prepared. You can never be too prepared, no matter what it is. Depending on when you hear about something or whether you're not. But I think we can be the change that we want to see for the future. As long as, maybe our kids or our grandkids will never know what we had to go through with this. And maybe this will be a great learning lesson for our generation, the generation below us. And I think, we're going to come out of this whole thing stronger and bigger and better. And that's where, we're getting here at the end of the show. And I always like to ask a few questions. And speaking of stronger, bigger, better, what and I never like to go negative, so I'm gonna go positive first. What's the best part of being a nurse?
Man, you're gonna get me to kind of to go away from the aspect of just taking care of patients, but I'm gonna say the flexibility, man. It's kind of hard to say that's not a thing. It's kind of with teachers in the education field, they have time off during the year, and everybody knows that. So when people kind of razz them about their ability to spend more time at home or taking vacations, that's a real thing. And for us, it's kind of the same way. We do have to work weekends. I still work every other weekends and more to pick up my fair share of shifts. But at the same time, only being required to work those 3 days a week as a full-time employee gives you 4 days a week at home with your family and friends and the ability to do things. So definitely the flexibility is nice. I got some little kids at home and, a wife to spend time with and projects. I like to be outside doing stuff. So, man, that flexibility, it's nice. And then also just probably the security. I'm going to lump those in together, flexibility and security. So you said the best thing, but I want to make it two. So the security and knowing that, when something happens, a pandemic or whatever, is going on, there's still going to be sick people and people that need help, and be able to do that. And, the best of my abilities, keep doing that and have a job to support my family. So.
That's great, man. And I think what's cool, a lot of people don't know this about you, but even though he's got flexible hours and stuff, this guy works harder on anything he does. He's a true American entrepreneur outside of his nursing field. And maybe down the road we can come back on and talk more about just being an entrepreneur in America. But yeah, dude, just because you're flexible
yeah, I'd love
doesn't mean that you have a lot of free time, All right, well, here's the second question I always like to kind of go into after this is, if there was one thing you could change about being a nurse, what's the one thing you would change?
Oh man, if there's one thing to change, it would have to start way up at the top of the food chain. It wouldn't be with me, man. I know that's easy to say. It's kind of point the finger at other things, but I would restructure the whole healthcare system. And I'm not leaning to one political party or the other, but I'm saying from the top down, I think it's a crime what people have to go through to get hospital bills and then pay hospital bills. And the way I make my money sometimes seems unfair. Not that I'm not providing a service. People that go to restaurants, they tip their waiters and waitresses. So I don't feel bad about making money for helping people, but I think that some of the lucrative money that people make in the healthcare industries, as far as upper level administration and then facilities as a whole, I think is a pretty tough thing to swallow sometimes, and you can get that all the way down into pharmaceuticals and equipment sales. If anything's got a medical attached to it within the description of it, it just increases its price by tenfold. So I think if I could change one thing, it would have to be that. And I know it's a big change, but that would definitely make my job worth going to a little bit more, is knowing that people were getting treated fairly, because I have to pay for healthcare too. So just knowing that, when I have to go and deal and have the same headaches as the common patient, I can't act like I should be treated differently, but I think we all should be treated differently. So I think if we could definitely reform some things about that whole industry, I'm not saying give free insurance out. I'm not saying require everybody to have it. I'm not even making any of those stances. And just clearly make that process, not so lucrative for certain people in the industry, and make it more about getting people taken care of.
Man, if that compassion didn't just show through with that answer right there that your mom was talking about, I don't know what does, dude. That's why I love you, man. You're one of my favorite human beings, and you have such a big heart. You're such a hardworking guy, family guy, and one of my dearest friends. And I think that answer right there, it's an answer about how to change something, and you wanted to make it a positive change. So it's beautiful, just like you, man. You're a beautiful person. And I love to end with this. This is my favorite thing to end with. Especially your field. Do you realize how essential, how crucial you are to the mechanism that is America, though?
Man, I thought we played a pretty good part in it before. The nursing industry is the largest field in the whole world. And I knew that before, through writing research papers, through going to school and doing things like that. You kind of research that, and you find nursing articles about anything that's ever been done. So I knew that we were a big part of the world, but I didn't know how essential we could be in times of this like great pandemic that's going on. And really, I guess I should say that the words that keep getting thrown out, is like being a hero. I don't really feel like a hero each day, but I do feel like that, where there's times that people do get to be off or spend more time with their family. I know personally there's people I work with that aren't going to spend any time with their family. They're quarantining themselves from their family. They're spending a lot less time, with their kids, their wives, their parents. So that part's been hard, as us, being in this industry. It's not something that we're used to. It's not the normal. So definitely hearing words like hero, and you hear the advertisements on TV, you see the thank yous that people's wrote on our sidewalks at our facilities, the thank yous from companies that send us food to feed us during the week, as we're on our shifts, working. And, the advertisements on the radio just saying thank you, it used to you'd hear stuff about first responders and discounts and things like that. Not that that's a big deal, but you go somewhere now and, they ask you if you're a healthcare worker or something, and you get to say, yeah, you're kind of wondering why they're asking that, but, then they give you a discount. Not that you wanted a discount, but it's just kind of one of those things that's just being looked at differently and makes you feel more essential. And sometimes you kind of feel a little undeserving of it. But definitely realizing that, America and the world is seeing the impact that the healthcare worker has, on them and what they mean to society as a whole. So.
I think that's what's beautiful about this whole thing. If there's any positive out of this whole experience, we're learning to appreciate the people who aren't as appreciated a lot of the time, and that's one of the reasons I wanted to have this podcast, this show, to enlighten people like you, the people that we're finally getting to honor, but kind of give people more in-depth of what you all do. You're not an influencer, you're not a celebrity, you're not an actor, you're not all this stuff that they usually praise up and the people bring on podcast, but you are just as important, in my opinion, way more important. And you guys are real heroes, the real people. You're the real Superman in this world. We can have our fictional, imaginary stuff, but you guys really, without healthcare workers, without the truckers, without our delivery men, without the people stocking the shelves at the grocery store, at our stores to get the toilet paper, without those workers, without the people like you guys, America isn't working, man. And so I just want to dude, I appreciate you. Thank you so much for everything you do. Thank you for all your coworkers. Let them know that, there's a lot of Americans who love and appreciate you guys. And like you said, you're seeing a little bit more of it now. And I think it's a beautiful part of this whole thing. So Austin, it's a pleasure, dude, getting to have you on. Guys, you can follow Austin. I'm going to put his his Instagram, all this stuff, if you guys want to follow him. See the beautiful family he has, all his kids, his wife. You can follow him on his Instagram handle down below. Do you want your Snapchat on there too, or you prefer to keep the Snapchat private?
It's okay, man. Whatever you want to put on there, you put on there, man. I just appreciate you. I appreciate you having me on there. So look forward to talking to you again, man. And any time, just holler at me. Love to visit.
Always, brother. All right, guys. Well, this was Real Americans again. Your guest today was Ostin Broadhead. He's a nurse in the healthcare industry, and he is a real American hero throughout these times. So tune in next week. Again, I appreciate you can follow Real Americans on Apple Podcasts, Spotify, and YouTube to see the video podcast version. And you can see what the heck Austin looks like, one handsome devil dude. And you can see what I look like too. But all right, guys, thank you again for tuning in. We'll see you guys next week.